As the temperatures start to get a little cooler and as winter slowly beginnings to be felt, we normally get more cases of the influenza virus starting to circulate, more cases of flu. At the same time, still cases of COVID-19 around, so it can be quite difficult to know what you're actually suffering from. Professor Cheryl Cohen is the co-head of the Centre for Respiratory Disease and Meningitis at the NICD. Professor Cohen, good afternoon to you. Is there any evidence to show that this flu season's already started?
So good afternoon, Stephen. Thanks for having me. And so the short answer is no, the flu season hasn't started, but we certainly are seeing an increase in reports of people with colds and flu, which we really expect as we go into the winter respiratory season. So there is a number of viruses circulating. Flu is among them, but we haven't really reached the full season yet, but we expect it in the next week or so.
How quickly does it normally happen? I mean, is there a way to even predict what's likely to happen over the next few weeks?
So with flu, it's really difficult to predict, whether the season will be severe or not and exactly when it will start. But usually it takes off fairly quickly when it does, and it normally comes in the winter. We are seeing a lot of reports of people in the general community saying they've had flu. Although in our surveillance, which really tracks confirmed cases, the increase we've seen is very small. But I think we do expect it will start. It will start in the next week or so. How bad it will be, that we can't say.
And cases of COVID-19, I presume you're still seeing incidents of that virus, still cases of that virus around?
Yeah, so absolutely. So COVID has really, after those first pandemic waves, it's really stuck around in South Africa, and it continues to circulate at relatively low levels. So if we compare COVID to flu, COVID is somewhat low. It's still around, but it's at a somewhat lower level than we would see for flu over a year. For example, over last year, we saw less COVID than flu, but it is around and it does continue to circulate, and it certainly does contribute to cases of respiratory illness, especially those which are more severe, either in hospital or people, when you really feel sick and you have body pains and fever, that might be more likely to be flu or COVID compared to some of your other viruses. So it is around, but nothing worrying right now.
And does COVID still mutate? I mean, I remember, how scary it was when you'd get, the discovery of a new variant. I presume that it still does that. And when it does that, can it also change the symptoms that are displayed?
Yeah, so that's a really important question. And in South Africa, we have dedicated surveillance systems that monitor respiratory viruses in South Africa, where we enroll people and test them systematically so that we can tell how much respiratory illness is around and what are the contributing viruses, and then we can characterize those viruses. So on these surveillance platforms, we systematically test for COVID, and then the COVID that we get, we also do viral sequencing and characterization on that COVID, and we're part of a global network that would then monitor the virus for mutations. And it is mutating. We do see the emergence of different strains, mostly evolving to evade population immunity. But so far, for the last year, really, we haven't seen any worrying signs in terms of it being more severe or more transmissible. So it is changing, but there isn't really a signal that it's getting worse or more severe, although hypothetically this could happen. I think the longer we go, however, without some worrying variant, the less likely that becomes.
There was a sort of flu pattern, or a flu season pattern, maybe is a better way to put it, before COVID-19. And you could kind of know what was likely to happen. You'd be able to look at what was happening in the Northern Hemisphere during their winter as well. Have we fallen back to that sort of pattern? I mean, did things go back to, I put this in inverted commas, back to normal?
Yeah, so absolutely. We typically see flu in the winter season, and another virus, respiratory syncytial virus, we typically see now just before the winter. And COVID really messed with those patterns. So when we had the lockdowns, it essentially stopped the transmission of all of the typical respiratory viruses. And then when we opened up, people didn't have immunity, and we saw big epidemics completely out of the typical season. What we can say now is that those patterns really seem to have stabilized. This year's respiratory syncytial virus season is really quite typical, peaking at the right time. Even last year's flu season showed a typical timing, although it was a bit on the more severe side. So we would expect that now the viruses have normalized, the population immunity has gone back to what it was before, and we would expect to see a much more typical and predictable seasonality of these viruses.
Are some flu seasons worse than others, and sort of outside of COVID? And what I'm trying to get to is, can you one year have a flu season that actually claims quite a few lives, or more lives than normal? I know some people are vulnerable to it.
Yeah, so that's absolutely one of the fascinating things about flu, which is different from many other respiratory viruses. Flu really continues to evolve and change and give rise to new strains, kind of like the COVID variants we're used to. And some of those really can be more severe than other viruses in terms of their transmission and the severity of the season. And so that's one of the main reasons we have surveillance to track the flu. And that's one of the reasons also why right now is really the time when people who are at high risk of severe flu should be going to get their vaccines. These are people who are elderly, people who have underlying medical conditions like diabetes or heart disease, lung disease, people living with HIV and TB, pregnant people. They should really all be going to get their vaccines right now to protect themselves against the possible severe consequences of flu, which could be even admission to hospital or even death in people with underlying illnesses.
Professor Cheryl Cohen, thank you, co-head of the Center for Respiratory Diseases and Meningitis at the NICD.